The Canary System, the diagnosis of dental caries, is presented by Kathy Tazewski, RDH.
What this machine can do is detect cavities at the very earliest stages. We can scan around old restorations to see if there's decay around an old restoration well before it'll even show up on an x-ray. We can scan through pit and fissure sealants to see if there's decay under an old fissure sealant. We've all seen those fissure sealants. There's a gray shadow underneath, and we're not quite sure, is that decay, just a little bit of shadow? The Canary actually has the ability to scan through a pit and fissure, and we can definitively determine if there is decay. We can also scan before you do a pit and fissure sealant to determine whether a pit and fissure sealant has to be placed or whether you have to do a little bit of a fissurotomy before that happens. The other great thing about the Canary system is that you can scan around kids having braces. We all know that kids get decay during their ortho process or their ortho treatment. What we do is we bring kids in and do a baseline with their braces on or off. We then have a baseline of what the structure of their teeth is at. Anything below 20 is healthy tooth material. So if we have scanned in 4 different spots around a bracket, we can monitor that every 3 to 6 months throughout their ortho process, and we can then introduce things like ClinPro, Vanish Varnished, so that they aren't developing any decalcification. The other thing that I wanted to talk to you about with the Canary is it monitors decalcification. We've all had patients come in, new patients that have decalcification on buccal surfaces in their whole mouth. A lot of times it has to do with children, or now adults, but have gone through ortho and have decalcification. Before, we just look at that and we watch it, and we look to see, oh, does it look worse? We look at the stain, but is that stain really telling us anything? It's not. What the Canary can do is actually give you a measurement of what is going on in all those areas of decalcification. We can have the patient in, scan all of the areas of decalcification. We have a baseline of decalcification. With a new patient, we don't know if the decalcification is progressing, staying the same, or getting worse. When you have a new patient in, we monitor it with the Canary. You have them back at their recall. We can then rescan those areas to see if it is staying the same, getting worse, or getting better. And as you know, with using the ClinPro 5000 and the Vanish Varnish, we can actually help improve those areas of decalcification. I'm just going to talk to you a little bit about finding fractures in teeth. When we are checking for a fracture in a tooth, we can actually scan a fracture line to determine if it is symptomatic. We all know that every tooth has some microfractures in them, but not all of them causes pain. When you have a tooth that is painful and you see a fracture line in it, we can measure it with the Canary. Anything over 20 on a fracture line means that there is destruction of the tooth surface. The difference between a microfracture that is asymptomatic to a fracture line that is symptomatic is the depth of the fracture. We can't see that fracture, but the Canary can measure that. Because the Canary can measure 5 millimeters deep into the tooth, it can determine whether that fracture line is going deeper into the tooth. And like I said before, the technology of the Canary measures the tooth structure. So when we are having a very shallow fracture line and we're getting a low number, we are able to see that that fracture line, it is picking up that fracture line, but it's also picking up a lot of good tooth material up to 5 millimeters deep. And so it'll still bring back a very low number. But when you have a deep fracture line that is penetrating into the tooth further, it's registering that whole 5 millimeters. So when we get the number back, we get a much higher number because we are measuring the tooth structure.